Do you have severe tooth pain? Worried you might need a root canal? Forget what you've heard. Today's root canal is often painless, feeling like a routine filling. Its purpose isn't to cause pain, but to relieve the intense ache of a dental infection. The fear you feel is based on discredited, century-old research that is no longer valid. We'll show you the modern tech, the high success rates, and why saving your tooth helps your whole body. Let's look at the numbers. Modern root canals have an 85% to 97% success rate, and in the long term, studies show 97% of these treated teeth are still there 10 years later. Forget multiple lengthy appointments. Today's treatments can often be completed in just one single visit, so you get high success, lasting results, and a fast procedure. How is this possible? The technology. It begins with perfect vision. Advanced 3D imaging gives your dentist a complete map of your tooth root system. During the procedure, specialists use high-powered microscopes to see tiny canals invisible to the naked eye. And cleaning those canals is high-tech, using fluid dynamics to disinfect areas traditional tools could not reach. With all this technology, what does the actual step-by-step process look like for a patient? We'll show you. First, the area is completely numbed so you feel nothing. Then, a small opening allows for gentle removal of infected tissue. Next, using those advanced tools, the inside of the tooth is thoroughly cleaned, removing the bacteria causing the pain. The clean canals are then filled with a sterile, rubber-like material, and the tooth is sealed to stop new infections. It's a precise, controlled, and quiet process. Does that sound different from the stories you have heard? But what about just pulling the tooth? Saving it is almost always the better option for your jaw and bite. When a tooth is pulled, the jawbone below it can shrink, and neighbouring teeth can drift into the empty space. And doing nothing is the worst option. An untreated infection can spread to your jaw, gums, and beyond. To guarantee that long-term success, there's one final step: placing a protective crown on the tooth. This nearly doubles the treated tooth's long-term survival rate by shielding it from fracture. A root canal doesn't make a tooth immune to new problems. Good oral hygiene is still needed to protect it, so we have saved the tooth and stopped future dental issues. But what if the benefits go far beyond your mouth? A recent study from King's College London found a direct link between root canal treatment and better general health. By removing the chronic inflammation in your jaw, the treatment was associated with better blood sugar and cholesterol levels. This is the modern reality. A virtually painless procedure doesn't just save a tooth, it can help your entire body. A beneficial treatment for your whole body. That just leaves one last myth: a long, painful recovery. The truth? Recovery is surprisingly fast. Most people return to their normal activities within 1 to 3 days. Any mild soreness is easily managed, and post-procedure care is simple. Avoid hard foods and keep the area clean. The myth is a painful, outdated procedure to avoid. The reality is a modern treatment that relieves pain and saves your tooth. Living with tooth pain affects your quality of life far more than the simple procedure required to fix it. If you are experiencing dental pain, do not wait for it to get worse. Modern root canal treatment is not something to fear. It's a highly effective way to become pain-free and healthy again. Find a qualified dentist today. Take the first step towards relieving your pain.